Good morning, everyone. Thanks for attending. You guys are all muted, but you can type your questions in the Q&A section. This is a recording that you can listen to later if you have more time. We will still be contacting people and sending you out the materials from this webinar. Today, we're going to be talking about HAP's dental plans, because dental plans is a very hot topic still for most of our members. And we're all looking for the perfect dental plan that starts benefits right away and does implants on day one. So, which is almost an impossible task, but HAP has developed a very nice designed group of packaged benefits. And today we have Kyle here to tell you about it. So Kyle, the new sales manager for Medicare, will be doing this session for us. Okay, Kyle.
All right. Thank you very much, Cass, and thank you everybody for hopping on this morning. I know it's later in the week training, but I really do appreciate you getting on. We get a lot of questions about dental. It's obviously, one of the top decision makers for a lot of members on which plans they're going to be going for, whether I like it or not. I always joke around saying dental shouldn't be their number one focus. That's a maybe, as opposed to some other stuff that are definite causes or expenses for them. But either way, it's what the members want and they're looking for. So HAP is definitely looking into our benefits and making sure we're making them as robust as possible. So this isn't going to be too long of a training today. Really just want to do some understanding of our technology caught up with me. All right, we're going to talk a little bit about our dental for our Medicare Advantage plan. So that's going to be both our embedded and our buy-up options and kind of how those work together. Our buy-up options for our MedSup product are find a dentist tool, and then we'll just have some HAP contacts at the end, make sure that you have all of our information, who to reach out to for what. So hopping right on into our dental for Medicare Advantage plans. So as you can see, I pulled over a slide from what was in 2022, now 2023. It's kind of old now for everybody now that we've been in the 2023 plan year for a while, but we wanted everyone to see that we are continuing to take a look at these benefits and how we can actually enhance them to make them better for our members. So the main thing is obviously we increased our max benefit coverage from 1,000 to 3,000 going into 2023. It was a big investment for us to be able to do that. But we wanted to make sure that the members were getting what they actually wanted out of the market. The other thing is the number one thing we were being asked for to add into the embedded coverage was extractions. So we were able to do that, to add that in with 50% co-insurance. But let's kind of go over line by line as to what's actually covered under your embedded benefits. So you get your 2 oral exams a year, your dental prophylaxis, or normal periodontal cleaning. So you can either have that over the gum prophylaxis cleaning that most people are used to, or for any of our members that may have gum disease, gingivitis, a few other things that require them to get that periodontal maintenance, that under the gum. It's not the deep scale or the descaling or what they'll also call a deep clean. It's a perio maintenance cleaning. Understanding members do sometimes have to get that done 3 to 4 times a year. The plan would actually be covering at least 2 of those, which not every plan covers that. Some of them even cover that periodontal as a comprehensive service. So we actually had that under our embedded preventative services. We have the bite wing x-ray. They also can do that full panoramic x-ray once every 5 years, but every year they get their bite wing x-ray. Brush biopsy is covered as well, and then fluoride treatment. I get asked all the time, why are we providing fluoride treatments for seniors? And number one, we live in Michigan, it's in our tap water, right? Or isn't that something that you give kids when their teeth are growing and you want to strengthen them? 100% correct, but by adding that additional fluoride treatment for our seniors, we're adding some strength to their teeth, hopefully eliminating possibility of cavities. And we understand that when members get cavities, if they do not seek treatment right away for those, they can become infected. And infected cavities actually can cause all sorts of other health issues, hypertension being one of the main things that can happen if they don't already have that. It can actually cause hypertension just by having an infected tooth. So that fluoride treatment is something that's very important for us to provide our members. And those are actually, I think, typically like $100 to $150 a piece if they were paying for those out of pocket. So it is a really nice benefit we're throwing in there for them. As for the minor restorative services that are covered under our embedded program, so that's going to be fillings. I don't care what kind of filling it is, you know, if it's the white or the silver, if it's in the front or the back, it doesn't matter. It's going to be covered at 50% with us. Root canals are covered at 50%. Crown repair, I know I get asked all the time why we're not covering crowns in the embedded. All I can tell you is that I know it's extremely expensive on the plan design side, but I have been pushing extremely hard to see if we can get those covered for next year's plans. I haven't seen our bid yet for next year. I'm hopefully going to see that soon, and I'm really praying that I see crowns on the embedded for next year. But for right now, it's just crown repair. We have bridge realigns and repairs covered at 100%. And then I'd mention simple extractions. So those are the non-surgical, the simple extractions being done at 50%. So that's all covered up to that max of $3,000. So what we hear from a lot of members out there is, okay, that's great, but if I have a root canal, you know, you're not covering it 100% up front, I got to cover another part of it. So that's where we got creative when we talked about our buy-up options. So I'm going to flip over to that quick here, and we have 3 different buy-up options, the Delta 50, Delta 70, and Delta 100. Before I get into what's covered outside of the normal embedded services, I want to talk about quickly how this buy-up option actually works with the embedded. So what's interesting about this, it actually creates a second plan code within the provider system, and they build both codes when they're doing these services. The reason is because it will actually coordinate coverage. So the first 50%, say you're getting a root canal and it's $500 for simple math purposes. I know it's usually more than that. $500 for the root canal. The embedded coverage is going to cover that at 50%. So that's going to pay the first $250. Without the buy-up option, the member would be responsible for the additional $250. But if they have one of these buy-up options, they're also going to get the second 50% covered by the buy-up. So $250 covered by purse A, which is the embedded, $250 covered by purse B, which is the buy-up. And the member just got that $500 service for $0 cost share. So that will be on, you know, any embedded service is going to be covered that way on the buy-up plan. But the buy-up options do bring in additional, what I would consider more major restorative services. So that's when the oral surgery is brought into play, or those oral, the surgical extractions. Bridges, dentures, and implants are brought in by this. The anesthesia and some other guards and adjustments are brought in by this as well. So it's a way to bring in at a very low expense with no waiting periods, some of these major restorative services for our members, while giving extra protection for those embedded services. So no, if you bring it in, it doesn't, you're not getting, you know, if you add in the buy up, no, the $3,000 from the embedded isn't going to apply towards those new services brought in, but you have that coordination for those simple restorative services. So to break it down a little bit, the Delta 50, that's covering pretty much everything at 50% outside of emergency pain treatment. The Delta 70 picks up a bunch of services at 70%, so you can understand the naming convention now. So the periodontics, realigns and repairs to dentures outside of, if you exhausted your coverage on the embedded, it's going to cover it a little bit higher, as well as those guards and adjustments. And then the Delta 100, again, those additional services that get bumped up are covered at 100%. The one thing I want to make sure that everybody's aware on here is the network. So our embedded service, our embedded services, the Delta 50 and the Delta 70 utilize the Delta Dental Premier and the PPO network. So the dentist can be in one, the other, or both networks, and those services will work for them. The Delta 100 is only the PPO network. So those services are only going to be covered by that plan if the provider is a Delta Dental PPO provider. The good news is, even though the Delta PPO network is the smaller one of the two right now, the Premier program has been sunset. So pretty much unless you graduated dental school before the year of 2014, you you cannot get that premier contract if you didn't graduate before then. If you graduated 2014 and beyond, you can only get that PPO network. So that network is growing as these younger providers are buying the practices. They don't get grandfathered into that premier because it follows the doctor, not the practice itself. So that network is ever growing, but it is currently slightly smaller. So I always say, if you haven't done the lookup, the Delta 100, you're really only going to be looking at, the member says, hey, I really need services done. I need them covered at a high amount, and I don't care where I get it. I don't care. You just find me a doctor. I need to get the services done. That's a great option for it. If not, personally, I would stick to the Delta 50 or the Delta 70. I think you get good bang for your buck there, as well as having a wide network to work with within the state. So I'm going to pause for a quick second because I know I'm going to be covering a few different segments of this. So if anybody has any questions in terms to the Medicare Advantage dental product and how it's covered and how it works with the buy-up options, please feel free to add it into the chat and Q&A box. If not, I'm going to move on to Medigap, and then we'll keep giving kind of in between these different things I'm doing a chance for you to ask questions. I haven't seen.
Well, there's no questions so
no
far.
Question? Perfect. Well, if you type one in, if you're still typing and I'm in the Medigap, I will come back to it. I promise.
Oh, sure. I'll be checking on it.
All right. So for our Medigap, so we have buy-up options that come along with our Medigap plans. It is the nice part about this as well is there are no waiting periods. So I know a lot of people may go with a Medigap and then use a different supplemental dental product to go along with that. That's great if you're going to supplement it along with our buy-up program, but you don't want that to be the only one because a lot of those will have year waiting periods for certain things. So if they're on a HAP Medicare Advantage or a HAP MediSup plan, they can get this buy-up option. What's really nice about our buy-up on the MedSup is that it then also brings in $175 in vision coverage through iMed. So really, it's not just a dental buy-up, it's a dental vision buy-up because you're getting both of those. The services covered are pretty much exactly the same under the Delta 50, 70, and 100. You're just going to notice the premiums a little bit higher. The reason why the premium's a little bit higher and the cost share for the Delta 20 is a little bit lower is just we're bringing in that vision coverage, so we have to adjust for that as well. But this has been a huge benefit for a lot of our members, and we have a ton of people going to our MedSup, just because we have lifetime included into it, and a few other things. And now with rate increases, our competitors have had, HAP is becoming way more competitive in the MedSup market. So if you're taking a look at those and you want to look at the buy-up options, just know there's no embedded, obviously, on that MedSup. So it's going to work just how it's listed here. Preventative services are covered at 100%. Then you're looking at those minor and major restorative services being covered as listed below. I would tell you most people on a MedSup are buying the Delta 50 or the Delta 70. And that's, again, because it utilizes both the Premier and the PPO networks. The Delta 100 on the MedSup buy-up, again, is also just the PPO network. So please keep that in mind if you are looking at that for a member. We had a lot of agents call us after the new year. They enrolled somebody in the Delta 100 and they're like, hey, their dentist doesn't take it. We have to remind them they are a PPO provider. In that case, right after the year end, sometimes we're able to switch them back over to a lower level so that they can get into their dentist that they want to see. But the longer we go on it, the more difficult that comes with membership and billing. And there's a lot of CMS rules as to what we can do around that as well. But the nice part is the coverages are pretty much exactly the same, just some dollar amount difference in the allotment pools, especially at that Delta 50 level. But the networks are going to work the same way across each and every one of them. Take a look. I don't want to spend a ton of time because there's really nothing new on that one. So outside of the actual dental coverage itself, the next question we get a ton, the next time we get a ton of questions on is how do we find the doctor and or the dentist? And a lot of people are going to hap.org and they're like, hey, why isn't it in your find a provider tool? I can't find any dentists in here. There's pretty much none there. That's because you actually have to go to deltadentalmi.com. So this is very important because if you do not go to Delta Dental MI, if you just go to Delta Dental or something else, and I realize I have a typo there, so I will fix that later. That's what I get for typing fast when I made this slide. That will, if you just go to deltadental.com, it's not going to show an accurate network. You have to reduce it to the Michigan plan level. So deltadentalmi.com. You're able to search by network, specialty, or area, and it only populates dentists participating in the selected network. So when you're on deltadentalmi.com, you're going to click Find a Dentist, either in that box down in the lower left-hand side. So pull my mouse over here. So you're either going to select this one, or you can click right up top to the Find a Dentist option there. After you click that, you're going to go to another screen. The important thing on this is you scroll down kind of in the middle of the screen, you're going to see Have a Delta Dental Medicare Advantage dental plan. So you're going to want to search on this based on what your member has. So if you're just on the embedded or using that Delta 50 or 70, you're going to want to search that Medicare Advantage, PPO, and Premier Network. So that's going to simultaneously search both networks. Mm-hmm. If your member has just the Delta 100, narrow it down and only search the Delta or the Medicare Advantage PPO. So that's extremely helpful to help narrow down, limit mistakes of doing that full search, and maybe you didn't check to see what network was listed if you do both, and cause any errors on that side. So once you've clicked one of those, screen here, you are going to select how you want to search. So the only thing that, and I keep giving Delta Dental this feedback, and I apologize if you see me looking this way, I have a bigger screen with everything right there on it. Mm-hmm. But there's a little asterisk, and again, I'm going to put my mouse over it, right here over zip code. So it looks like you have to enter in the zip code. You actually, that's just saying you have to fill in some of these fields. What I like to do is, unless I know for a fact where the dentist is, I'm going to search just Michigan. So in there, I'm going to just drop down, put it to Michigan, and search the entire state. If you are doing it by zip code, you can then obviously search by extend radius. Maybe you don't have the dentist's exact zip code, but they say it's a 30-minute drive to them or whatever it may be. You can search that way as well. And then at the very bottom of that screen, I'm going to say you want to put in, I usually just use the dentist's last name. Make sure you do select a specialty if you're looking for an orthopedic surgeon or something like that. You want to make sure you narrow that down. Most of the time, you're going to be looking for a general dentist, you know, who their main provider is for that. But they may be saying, hey, I'm getting something done. I'm going to see this oral surgeon or whatever's happening. If that's what you're looking for, make sure that you change that specialty there. And then after you do that, you're going to be taken to this page and I just did a blanket kind of zip code search of a zip code in Commerce, but you're going to see Medicare Advantage networks. You see it lists if it's Premier or Premier and PPO. If it was just the PPO, it would say that as well. But what I can tell you is they've had some glitches in their system where when you're doing this Premier and PPO search, for some reason, it's not populating anything in there. So there's a little trip and tick. And actually, I'm going to pull it up and just show you while we're doing this, because I think it's easier for you to see it directly. So let's just do this together so you can see it. All right. Dental MI, find a dentist. I'm going to search the Premier and PPO network. As I mentioned, I just do Michigan, though you can do zip codes if you wanted to, if you're just looking for a general dentist in that area. Scroll down. I'm going to type in Smith because I've got to assume there's more than one Smith dentist in Michigan. All right, perfect. So their system right now is having a little glitch. So I want to show you this little trick here. You're going to see that the box is blank for this Constance Smith. That means they're just in the Premier network. If you see a comma, they're in the Premier and PPO. Just for some reason, their system's having a glitch depending on certain search quantities as to whether or not we'll populate those. So blank box, they are in the Premier, if there's a comma, Premier and PPO. But just know if they populate in this, they are at least a network. So they're at least in the Premier, but they may also have the PPO network attached to them as well, just based on whether or not it has that comma. So that is how you navigate the HAP website or the Delta Dental Find a Doctor tool. It is super simple. It's just simply remembering that you have to go to that Delta Dental MI website to take a look so that you're getting everything taken care of properly. And then last but not least is our contact information. Our lead sector consultant is Jason Glutzner. We will be adding in another lead sector consultant, obviously backfilling my prior role here, hopefully in the next month or so. But for now, Jason is there. And then, of course, myself is available as well. I'll take real quick to explain my new role. So I'm the sales manager over Medicare and individual sales through our external partners. So that's you as independent brokers and anybody essentially that's not internal call centers. So anything I can do to help, please. I know I'm going to be in a lot more meetings than I have been in the past. So text message, I will get back to you right away. Please don't think I'm ignoring you. If you call me and you go to my voicemail, I promise I will get back to you as soon as I can. But Jason's obviously available as well. If you have general questions, so you enroll somebody into a plan, they said they didn't want to have dental in their plan. And 2 days later, after it's effective, they go, oh, I really actually want to add that embedded dental. You actually can just email that general questions and Medicaid status inbox, the HAP Medicare agent at hap.org, and we'll be able to go ahead and take care of that for you. That's actually a good point I should bring up. So when you add dental onto a plan, you have either up to the time that you enroll it, and then you have 30 days after the enrollment to add that on. During OEP, you can actually add dental through the end of OEP. So that 1-1 app that you wrote during AEP, you actually have until the end of March through OEP to add on the dental. If you have a T65, that's a 4/1 effective date, you have until the end of April to add it on. They can cancel it anytime, but they can only add it on within 30 days of their effective date. Contracting, obviously, outside of anything that IED is able to help you out with on there. If you have any questions in terms of, how you're getting paid, is it to your agency or to yourself personally? You don't need to change bank accounts. You can reach out to Jamie Winton on that. And Punita Sharma is our commissions person. So with that, I will leave it up to any questions. Cass, if you have anything, or if anybody wants to type anything in. But again, thank you very much, everybody, for joining us this morning.
I don't see any questions right now. If anyone has any, please add them.
I must have just done such a good job explaining.
Oh, you did. We will be having Kyle back again to do a grassroots advertising type webinar later in May. So look out for that. Oh, I do see a question. Just thank you, Kyle. Not a comment. Well, I know I learned a few things today, and certainly just being able to tell our agents how to use these tools much better is going to make you a better salesman, and also probably make your members a lot more savvy about how they pick their plans and use them. I'd like to thank you all for coming out again today.
Mm-hmm.
And
sorry, we have somebody wanting to see.
Oh, we have another question. Oh, can you put the benefits charts back up?
Which one? The embedded or the MA buy-up or the MedSup buy-up?
Both for a second.
Okay.
I will be sending these out, so don't feel that you have to make a lot of notes on these today. I will send out the whole presentation. And again, we are also recording it so that you can also check it out on YouTube.
Can these be sold with any MA plan? So these can be, the buy-up options can be brought in with any HAP Medicare Advantage plan. The only one that does not have the buy-up, I should clarify, is our DSNP plan, because that has a different benefit structure from all of our other plans. So the DSNP cannot add on buy-up, but all of our other Medicare Advantage plans, you can add in the buy-ups. You cannot add it on individually with another carrier's product. If you think of something after this, I'll put my contact information back up again in just a moment. Feel free to give me a buzz or email, text after this, and we can talk through individually as well.
Yeah, and I certainly will be available. Get the answer to any of your questions. The question says, can this be sold separately with the MedSup?
So our MedSup buy-up can only be sold with somebody on our MedSup. They cannot be on another company's MedSup and buy ours individually. So they have to be a HAP MedSup member to access the buy-up options for MedSups. Cedric, no, because even though there are additional coverages, our buy-up is embedded in with our plan designs when we file it with CMS, so it is not a commissionable product.
Are there any other questions? As I said, I will be sending this presentation out, and you can always call Kyle, or certainly you can call me and I will get the answer to whatever you need.
We are just in Michigan for Steve's question.
Mm-hmm.
All right. I think that's probably everything.
All right, then. It's 10:30 and did a good job keeping everything short and sweet and informative. Thank you again, Kyle. And thank you everyone for coming out today. And I hope you have a great Friday and rest of the weekend.
Thank you all very much. Thanks, Cass.
Okay. Bye now.